Leaking urine is no fun. That is clear. But is it dangerous? I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. In this video, we'll talk about problems that can develop because of urinary incontinence. We know it's no fun, but did you know that incontinence can contribute to major health problems? Before we get into that, we want to make sure that if you have incontinence, we want to make sure that it's not the sign of a major health problem you may already have. Urinary incontinence can be a side effect of medications you might be taking, or it can be a sign that you may be developing a serious health condition like multiple sclerosis. So it's a really good idea to get checked out if you're having incontinence, especially if it's developed recently, it's a new thing. It's good to get it checked out. Now, assuming that you don't have something serious, that it's just the common type of incontinence that often happens after childbearing or as we get older. And the way I say that, it makes it sound like it's just normal. It's really, really common, but we don't have to accept it as being normal. There are things you can do. This video, we're staying focused on problems though, but I want to get on my soapbox and tell you all about what you can do. So, problems that urinary incontinence can cause. First of all, emotional problems. Women experience shame, embarrassment, fear other people will find out. Often women feel like their sense of self is damaged, like I'm not the woman I used to be. Sometimes women with incontinence will miss out on socializing and activities that you enjoy. There are a lot of psychological and emotional issues that can come from that. If you end up saying no to invitations or activities, you end up isolated, you end up on a rigid schedule, you get anxious, women can end up depressed. These are real risks that can happen with incontinence, depending on how you manage it. Now, all of that is really up to you. That the whole psychological side of it is something you can work with. And again, there are things you can do to get better. But if you are choosing between going out and staying in, if you're avoiding activities you really want to do, not seeing people, put on an adult diaper and just do it. It's so much healthier for you to get out and live your life in spite of incontinence. And again, there are things you can do. That's for another moment. Right now, this video will talk about problems. Another problem is dehydration. Sometimes women don't drink enough fluids in an attempt to avoid having a pee accident. This is misguided, partly because it's not healthy, but also because if you don't drink enough, your urine becomes more concentrated, and it actually puts you at increasing risk of having a leak. When the urine is more concentrated, you may even have more incontinence. So dehydrating yourself is really not healthy. We all know it's important to stay hydrated and drink plenty of water. And for women, as you get older, it's especially critical to stay hydrated. So please don't get dehydrated, which is something that happens to a lot of women when they're trying to control their accidents. Another thing that can happen with incontinence is if you avoid exercise because of it. I get it. Nobody wants to put on an adult diaper on the way to the gym. Maybe work out at home instead. Put on an adult diaper and stay home. If that's a time when you really feel like, you are going to lose control, you can count on it. Maybe you'd rather exercise at home. Fine, as long as you're exercising. Because if you don't exercise, if you're avoiding exercise, you put yourself at increased risk for heart disease, cancer, obesity, depression, dementia, stroke, diabetes, high blood pressure, and more. Exercise is so important. So, 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 so important. I always think about my grandmother who lived to be 97 years old. She was super healthy, and she was actually a swimming teacher until she retired at age 95. And she always said it was the pool that kept her going, and it really was. So the solution is take care of your incontinence. To the degree that you can't take care of it, keep living your life and avoid those avoidable problems like dehydration and isolation. By the way, when you're looking at solutions for incontinence, you might want to put surgery at the back of the list. Of course, it's up to you and your healthcare team to make a decision that works for you. And surgery is not only the most expensive, but it is the most dangerous way to treat incontinence. And there's a super high rate of complications with incontinence surgery. So my personal preference is to see surgery at the back of the list, last resort. First, try safe, easy, natural solutions like Kegel exercises. You recall that I'm the Kegel Queen. I'm a huge advocate and believer in Kegel exercises, but they need to be done correctly. In order for Kegels to work and give you the therapeutic benefits that you want, you need to do them correctly. And in my experience over many years, I've found that literally almost zero women are doing Kegels correctly without getting the real information as they do in my program. 99.99% of women are not doing Kegels right, even if you learn from a childbirth educator or a physical therapist or a doctor. So that correct technique, it's simple, but it really needs to be correct. To find out more, please visit me at kegelqueen.com. I'm the Kegel Queen, and I'm here to help.